Welcome to Empowered. I'm Elizabeth Naumovski. Today, we're shining a light on a topic too many women silently struggle with: pelvic floor health. My guest is a specialist who helps women reclaim their strength, confidence, and comfort through expert care and simple life changing strategies. We'll get into the most common bladder issues she sees and treats every day, from leaks during laughter or workouts to that urgent feeling you just can't ignore. For viewers at home, she'll share practical everyday tips and habits to protect and strengthen your pelvic health right now, and there's no equipment needed. And we'll break down the basics. What exactly is the pelvic floor, and why are these often overlooked muscles so critical to everything from bladder control and core stability to intimacy and long term vitality? Today, I'm joined by Lisa Napoli. She's the founder of Physio with Lisa, and she's a registered orthopedic and pelvic health physiotherapist. This is essential knowledge for women of all ages, empowering you to take control of your body with facts and not fear. Lisa, welcome to Empowered.
Thank you for having me.
Of course, I'm so excited to talk to you about this because I don't
Mhm.
think anyone's discussing it. And I think that at the end of this show, you are going to empower so many women. So let's begin. Please
Okay.
explain to me, what is the pelvic floor and why are these muscles so important to us?
Yeah. So the pelvic floor, if you could imagine the pelvis, so that bony structure. And then within that, we have a group of muscles, nerves, ligaments, and vessels. And so at the base of this, we have the pelvic floor muscles. And so they do a lot for us. Okay. So they do support. So one being they support our organs. So that being the uterus, the bladder, and the rectum. They also play a role with our bladder and bowel function. So the ability to stop and go when it's time to pee or have a bowel movement. So it plays a role there as well. Sexual function is another key thing. So with that, these muscles play a role with satisfaction and the ability to have an orgasm. And then another key feature it does is, as you were mentioning, is part of our core stability. So it's actually one of the four core muscles. So it works together with our deep abdominals, the back muscles, and our diaphragm. So all together giving support to our spine and pelvis.
So these
Yeah.
silent muscles are super important for us.
Yes, they do so much,
Yeah.
as you can tell through that, trying to get through that list quickly. Yeah, they do. Yeah.
Okay, so what conditions can pelvic health physiotherapy help treat?
There's so many. So if we think about bladder, so people dealing with leaks. So bladder leaks where, you commonly hear about like, oh, I coughed, I sneezed, and I leaked. Yeah. So those including, women who are dealing with if they jump or run, so that higher impact. So any urinary leakage with those movement patterns. And then we also have women dealing with that urgency and frequency. So that urgency of like, I gotta go or else they're worried they won't make it. And in some cases, women actually will leak because they won't be able to make it in time. So there's that. And then when we talk about bowel movements, now people dealing with constipation, hemorrhoids, fissures. So any difficulty actually evacuating is something else that we help with. Um, Other common conditions, pelvic organ prolapse. And then when it comes to some conditions, when we talk about sexual function, um, things like vaginismus or vulvodynia, um, pain with any form of intercourse or insertion, and then any type of pelvic girdle pain. So, pain anywhere in that pelvis or genital area. So, helping people with that. Um, Women suffering from endometriosis, even other women with painful periods. And then we even see women within that pregnancy and postpartum population. So, when it comes to pregnancy, helping women, whether it's guiding them through exercise during those different stages of the trimester, so guiding them accordingly with their body, how it's constantly changing, um, helping them even with delivery and labor, so preparing them for that. And then even with the postpartum population, if it's issues that arise, like working on C-section scars, perineal scars, diastasis recti. So there's so many things, but yeah, these are some common ones.
So when we
Hmm.
come back,
Yeah.
we are going to discuss more of how to deal with our pelvic health. So please don't go away. We'll be right back. Welcome back to Empowered. I'm Elizabeth Naumovski. Today we're optimizing your pelvic floor health. So Lisa, you
Mhm.
delved into a lot.
Yeah.
So let's focus a little bit. How can you, if you can walk us through what an initial pelvic health assessment typically looks like?
Yeah. So, okay. So initially, so the person comes in, and then for maybe like 10, 15 minutes, we're just sitting and we're talking. So I'm gathering more information and details about what it is that they're dealing with and ultimately what their goal is, right? And so after that, then I want to gather some objective information. So this could be something like I'm looking at just how their body moves through their spine and the hips because they're so closely related to the pelvic floor and they can play a role. And then following that, um, I could, depending on the condition, I might do an internal assessment. And so, why that's important is because the best way to access these muscles, because of where they're located, is internally. So, this may entail a vaginal or rectal assessment. And with that, I'm testing out these muscles. So, we're looking at, is there any pain or tenderness with these muscles that are reproducing their symptoms and playing a role? Um, if their situation sounds like something where there's a weakness issue, testing for how weak are these muscles, right? So, um, what's their strength like and how long can they hold a contraction? So, we're getting a baseline. So, then that way we know how to create a great treatment plan for them. And so after that, I can also test for some things depending on, again, the condition. If it's watching how they can control their breath and pressure, so looking for things that could relate to prolapse. Um, and then after I get all this information, then at the end, I'm talking to them about what I feel, and we discuss together actually what is going to be a good treatment plan for them. Yeah,
Okay, so let's delve into bladders. What are
yeah.
some common bladder issues that you see and you treat?
Yeah, so some common ones are urinary leakage, and this could be due to what's called stress urinary incontinence. And then, really, what that is just a pressure control thing. So, this is when women you hear them talking about, I leaked urine because I cough, sneeze, or I'm avoiding jumping on the trampoline, right? This is a common one I hear, especially with moms. Like, I don't want to jump on the trampoline because I'm scared I'm going to leak, or someone who is like, hey, if I run for 5 kilometers, then I start leaking. So those are common ones. And then another group of um, urinary issues that I also see that's pretty common is people who are dealing with that urgency and frequency. So that sensation of the urge, but it feels very strong, like they have to go or else they're just not going to make it in time, or frequency whereby they're like, hey, I feel like I have to pee like every 10 minutes, right? So these are
And
some of the
those are
things that
common
can,
issues
yeah,
that
they
most
are.
women go through.
Yeah. And the treatment for them is very different. So, yeah.
So what I want to go through is true or false,
Okay.
right? I want to
Yeah.
play the true or false game
Yeah.
because this is, we're just opening up this new topic here. And then we're going to have to go to commercial break and then continue. So
Yeah.
true or false, bladder leaks are a normal and inevitable part of aging.
That's false. Yeah.
Why?
Because I know it seems very popular, and I know those commercials are quite popular about um, bladder liners and pads, but no, it's not. It's something that women should not have to deal with. So at any stage, right? Even if it's the common, what we know of, like, oh, I just had a baby, or I'm over the age of 60, these are not things that we want to normalize or accept. So this is a sign that someone has pelvic floor dysfunction. And what's great about my field of work is that this is something that, like, we can help women treat and overcome. Yeah.
So Just before we go to break, I just want to ask you, like, does it take a long time to treat all this?
It can, depending on where they're at and what stage, but sometimes women will start seeing improvement within a couple weeks. Sometimes on average, like 12 weeks. Enough if there's a weakness issue, maybe 12 weeks, because that's how long it takes for muscles to build up that strength.
And muscles
Yeah.
have memory too, so.
Yes, yes. So again, depending on the severity for each person, it varies, but we could say on average anywhere from a few weeks to like 3 months.
Okay,
Yeah.
so we'll be right back with more pelvic floor health, so please don't go away. Welcome back to Empowered. I'm Elizabeth Naumovski. Today we're optimizing your pelvic floor health. Okay, true or false? Let's
Okay.
continue.
Yes.
People who urinate frequently have smaller bladders.
So that's false.
Okay.
Yeah. So what's happening usually here is the bladder is not actually smaller. What they're dealing with is what's known as overactive bladder. So the bladder is technically contracting a lot more than usual. And so with that, that then causes the person to have to urinate more often. And so that bladder is now eliminating at smaller volumes. So smaller volumes, now they're going more often. And that's why they feel like I have a small bladder and feel like they gotta go every 10, 20 minutes.
Okay.
Yeah.
So urinary tract infections, also known as UTIs,
Mhm.
so many people say, well, that's because, they're contracted through sex. You're having too much sex.
Mhm.
True or false?
That's false.
Yeah.
Yeah. It's one way that, but it's not everything. And with UTIs, there's various causes to that, but one common one that I notice in practice, and that's also known, is it's because of a hormonal change, and that is due to estrogen levels being lower, and we see that more commonly in the postmenopausal population, right? So estrogen does a lot for the body, and one of the things is it helps fight off infection. So when we have lower estrogen, that increases the risk of infection. Um, and then another quick thing I'll mention too is those people, that population who are like, oh, I'm just going to avoid peeing. I'm going to delay it. I'm holding my bladder just because maybe they don't want to pee in a public toilet or based on their job where they don't have time to go. Um, Holding that in at large volumes for a prolonged time, and if they're doing that for quite a while, the urine sitting in the bladder, and then that just increases their chance of bacteria collecting, which then increases their risk of infection. So, yeah.
Okay.
Yeah.
True or false?
Mhm.
Men have a pelvic floor and can be treated for pelvic floor dysfunction.
That's true.
Okay.
Yes. Their anatomy, those muscles, they're the same as females. Um, yes, externally things look different, but those muscles are all the same inside. And yes, they can be seen for pelvic floor dysfunction. They also have to deal with urinary issues, so that frequency or hesitation. They also deal with pelvic floor pain, so muscular pain around through there. Um, Issues with sexual dysfunction. So, yeah, they have issues that can arise as well. Yeah,
All right. True or false? Everyone should be doing Kegels.
false. I know.
Interesting.
Yeah, yeah. It's popular to know, like, I got to do Kegels, right? To make my pelvic floor strong or if I'm leaking. But sometimes, for example, women could experience leakage, and it's not because they're actually weak, it's because the muscles are too tight. And if the muscles are too tight, by adding Kegels, which is a pelvic floor contraction, this could actually make their symptoms worse. So, um, this is something I remind women, and I've had quite a few. And even recently, I had a woman come in and she's like, I've experienced leakage. I looked this up. I heard I was supposed to do Kegels, but I actually, when I was doing them, I noticed later my symptoms getting worse and I'm actually leaking more and more often. And so I educated her about it's not always a strength issue. Um, because if there is tightness, that can actually make things worse. And we have to treat this very differently. Yeah.
Okay. Wow. Ugh. So you mentioned the word prolapse a
Hmm.
couple of times in the
Yeah.
past, a couple of segments.
Yeah.
True or false? Well, no, not even true or false. Prolapse. What is it and how is it treated? Because I've heard many women talk about it.
Yeah. So prolapse is when one or more of the organs start to descend into the vaginal canal or kind of push up against it. And this could be the bladder or the rectum or the uterus. And so what women will typically notice and comment is they talk about feeling this pressure or this heaviness, or they may say like, I notice there's a bulge down there when I'm showering, right? And so what they're noticing is that descent and pressure of the organs. Um, and so I think you had,
Lisa, if I may,
yeah,
hold that thought because
okay,
I want to really talk about this when we come back from commercial break
okay.
because this is important and I know a
Hmm.
lot of women are struggling with this and I don't want to, I don't want to cut you off and then start from scratch all over again.
Yeah.
So please don't go away. We'll be right back with more, so many more pelvic floor health um, treatments for us all. Welcome back to Empowered. I'm Elizabeth Naumovski. Today, we're optimizing your pelvic floor health with Lisa Napoli, founder of Physio with Lisa. She's a registered orthopedic and pelvic health physiotherapist. That is such a mouthful. Okay, so we were talking about
Yeah.
prolapse. What
Mhm.
is it and how is it treated? So please continue.
Yeah. So now let's talk about treatment. So with treatment, primarily it's about strengthening. So strengthening these pelvic floor muscles so that they're stronger and they have that better ability to hold up our organs, right? Um, Also, at times, I'm also including things like strengthening the muscles surrounding there. So whether it's core muscles or hip muscles, I'm also educating women on how to breathe. So the breathing mechanics, because if they're not breathing and moving properly, that pressure change is going to play a big role in their symptoms and aggravate, kind of make things worse. Um, so those are the key things that we're working on for treatment to
There's a
help with
lot.
that. Yeah, there's so much to this.
There
Yeah,
really is,
yeah.
because when you and I were talking on the
Mhm.
phone, when we were trying to figure out a topic, you were saying that you could talk about this for weeks on
I
end.
could, I could. I think each question I could talk for another half hour.
So what I want to do is
Mhm.
in the show opening, I talked about simple tips or habits. So for viewers at home, what simple tips or habits can you share to help them take better care of their pelvic health?
Okay, so learning how to pee properly. So a big one is um, what we call like don't power pee, and that is women who often feel rushed and they're pushing their pee out. So essentially, when we're voiding and want to eliminate urine, our muscles, the pelvic floor muscles, need to be relaxed. By pushing them, we're doing a disadvantage to our body, to our organs, and to those muscles. So that is a big no. And I tell women, this is your time in like
Take it.
relaxing. Yeah, take it. Like we're busy in life, but this is something you need to be doing and that you can spare like 2 minutes of freedom. Okay. So I had this conversation with two women this week already, educating them on that. So that is a big one. Um, Also, bowel movements. Straining is a big no. So I do provide tips for people, and one of them could be as simple as using a footstool, which helps to allow them to evacuate a bit better. Um, and then even the simple education of knowing, like, if you're having pain in that genital area or pain with intercourse or anything that is to be inserted, it's not normal. And we can help with that. So just listen to your body. If something feels wrong, it's a sign that
I like the
you
fact
need
that you
to,
said it's not normal because
yeah,
to some people that is normal. So they don't think that there's anything wrong.
yeah,
And I think that's important that you just said if you have pain or whatever, it's not normal.
yeah. Like I remind them, things could be common, like leakage and pain, but they're not normal.
So,
Yeah,
last question before we end.
yeah,
What menopause related symptoms can pelvic physiotherapy help manage?
yeah. So a lot. And kind of going over what we talked about.
Mhm.
So especially, yeah, with menopause related because that drop in estrogen. So any urinary issues, right? Some common ones that show up are that the increase of urgency and frequency or leakage. Also helping people, women with prolapse, um, same pain with intercourse. So because of that change of estrogen and the tissues could just be thinning and drying out. Pain with sex is a fairly common one. So we can help women manage those symptoms as well. So
So,
yeah,
do women that have had hysterectomies also go through this?
yes, they can also deal with various symptoms and conditions as well. Yeah.
Okay, so last, we've got
Mhm.
20 seconds left.
Okay.
Final words of wisdom to women who are suffering.
Your body is telling you something. So you need to listen and follow up with it, right? There are so many of us health practitioners who can help guide it. So again, the common doesn't mean it's normal. And these are signs of there's an issue going on. So you have the ability and we love what we do. So seek out that help because
It's
it's
important.
so important.
Thank you
Yeah.
so much, Lisa.
Yeah. Thank you for having me.
Thank you for coming on. Take charge of your health and seek support. You deserve to feel comfortable and confident in your body. I'm Elizabeth Naumovski, and I'm here to empower you and make frugality fashionable. Bye for now.